Hello, my name is Dr. Brian Reid, and I'm a naturopathic doctor. And this is a video about working with patients who have been through the antibiotic gamut, going after persistent borreliosis, also known as chronic Lyme disease, co-infections like Bartonella, Babesia, Mycoplasma, maybe chronic viral infections, using predominantly or entirely a pharmaceutical approach. So I've had many patients in my practice to date where they've gone that route and they are in many cases improved. Usually when they come to see me, they're not 100% better, otherwise they probably wouldn't come in to see me. So I'm sure lots of folks get 100% better using an exclusive pharmaceutical approach. I just don't see them in my practice because they don't bother coming to see me if they're all better. But patients will come in and many of them are improved, some of them notably so. Like some patients are like 80% better, which is pretty darn good. Some of them might be more like 50% better. Some of them are only 10 or 15% better. Some of them are no better at all, and some feel worse than before they started with the antibiotics, and they have different symptoms and things like that. So it's a mixed bag. But this video is primarily talking about patients who have gone the pharmaceutical route, so to speak, with antibiotics, various antimicrobials, and they're, let's say, 50% better or more, and then they come to see me and we see what we can figure out from there, try to get them better the rest of the way. With the patients who say achieve less than 50% improvement, we'll maybe save that topic for another video. So for these folks, there's a variety of things that I wind up seeing with these patients, and sometimes what we need is just, believe it or not, a more rounded out antimicrobial approach. So sometimes just by adding in herbs into the mix, where herbs have the advantage of going after microbes as well, and in some cases, in my opinion and in my experience, more effectively than certain pharmaceuticals. A great example would be antivirals. Antiviral pharmaceuticals can work very well for some viruses, but by and large, in my experience at least, herbs seem to outshine them in terms of being more versatile and I think more effective at going after things like Epstein-Barr virus or cytomegalovirus or Coxsackie virus or whatnot. So again, just my clinical experience with that. And then also, if there are, say, bacteria that are afoot, like Bartonella or Mycoplasma or Borrelia, granted, antibiotics can be very effective at going after those microbes, but antibiotics aren't necessarily perfect at killing off every single last one. Maybe some of them develop some antibiotic resistance, or certain antibiotics like doxycycline, for example, not the best at getting into biofilms. And so I think that adding in herbal antimicrobials helps to round out the antimicrobial regimen. And granted, some of these patients are still on antibiotics, and so we're working with their herbs at the same time. But that's oftentimes a helpful component helpful component of a treatment protocol for patients who have, say, achieved at least 50% improvement post pharmaceutical regimens. Other things that can be helpful are adding in other antimicrobial treatments, so things like intravenous photobiomodulation, which is something that we use here, or intravenous ozone therapy. And then outside of the antimicrobial approach to things, then a lot of these patients wind up needing support for their mitochondria, and I posted lots of videos about that. Happy to post about it again if anyone's interested or has questions about that, but it's something that can oftentimes be very, very important and helpful, working to make sure that detox pathways are working properly, addressing heavy metals if they happen to be afoot, addressing coexisting mold toxicity or mold allergy issues that might be afoot, and then also looking at something called low-dose immunotherapy, which I've also posted quite a few videos about, but that can be very helpful for folks, and I would argue even more helpful for the folks who have achieved less than a 50% improvement with their pharmaceutical regimen. So the main take home from this video is that if a pharmaceutical regimen has led to improvements, but there's a plateauing that's occurred, a plateau that's been reached, then there are other things that we can bring into the mix that can be quite helpful. And I think it's just important to be aware of that, so that folks know what their treatment options are. So if there's any questions or comments about this topic or anything else, just post it in the comment section below, and otherwise I will leave it there.